We saw a couple years ago with Matthew,
Yes.
the nursing home deaths in Hollywood, Florida, how tragic that was. It would seem to me that hospitals, nursing homes, assisted living facilities should know who to contact, should know,
Right.
in the event of a natural disaster, impending disaster. Do they?
They don't, and that's part of the challenge. So Powered for Patients, we're a nonprofit. We were created after Hurricane Sandy, when emergency power failures in 5 New York City area hospitals prompted emergency evacuations. You mentioned the tragic deaths at the Hollywood Hills nursing home last fall following Hurricane Irma. Avoidable deaths that occurred because of a prolonged power outage that drove temperatures to an unsafe condition. Those could have been prevented by clinical decisions made by leadership on the ground, but it underscores the fact that power loss is truly a matter of life and death. And for Powered for Patients, our focus on emergency power resilience is the flip side of the coin. The other side of that coin is power restoration. If you don't have utility power, you must have emergency power. Once utility power comes back on, you don't need emergency power. But we've seen in these major disasters prolonged power outages that stretch generators well beyond what they're normally expected to be able to operate for. And there are failures in every major hurricane. Just last month with Hurricane Michael, FEMA deployed 62 federal generators to Florida because of generator failures or the lack of emergency power at critical facilities. 2 of those went to senior residential healthcare facilities. In Georgia, FEMA deployed 8 generators, 5 went to hospitals, 2 of them went to senior healthcare facilities. What would be very interesting for us to look at after the fact is how long did it take for those facilities to get that help? When did they know they needed help, and how long did it take to get help there? A big part of our focus is accelerating that process because not only do facilities in many cases, John, not know who to call, they don't know when they should call. So one of the innovations Powered for Patients has developed and is advancing is an early warning notification. Right now in this country, what happens when hospitals or other facilities lose emergency power, after they get off the phone with their generator service provider, they don't necessarily pick up the phone and call government. And if they do, they'll call to say, we have bad news, we've just lost our generators. That's a terrible lost opportunity for government and utilities to get an early jump start in averting the need for a patient evacuation. And so we are asking every hospital in this country, and soon nursing homes and long-term care facilities, at the first sign of generator trouble, as soon as you hang up the phone from your generator service provider, pick up the phone and call the government. That gets back to your question, do they know who to call? We don't think they do. And frankly, depending on what state you live in, who you call is different.
I'm going to ask you that. It varies from state to state. You might call the EOC, you might call some other contact at a hospital association, right? I mean, you don't know who to call.
You don't know who to call, and every state's different. So I live in Rhode Island. We had a stakeholder engagement project with DHS funding with Powered for Patients. In Rhode Island, you have to call the Department of Health. The Rhode Island Emergency Management Agency has said, we do not want to hear directly from hospitals, we only want to hear from our Department of Health point of contact. In Florida, the public health person has no official role in that chain of command. A facility needs to call the county emergency management person.
It really surprised me that there is no, from talking to you, dedicated phone number. I run a facility, a hospital, and I don't have a dedicated number or a point of contact of who I'm supposed to call if, we just lost power, or we're about to lose power. Don't even know who, I don't even have a number.
Well, I mean, hospitals are required in their emergency planning to have a communications plan, and they should know who to contact in those situations, both at their utility and in government. But what's happening, unfortunately, is those conversations are not happening. You know, during blue sky days, government officials are not reaching out to hospitals to say, hey, by the way, I'm Eric Cote, I'm your liaison. Should you have a problem with emergency power, here's my cell phone, call me any time of day. It is not happening. And that is something that we're working hard to change.
And even more basic than that, many of these facilities don't really have a handle on whether their backup power systems are even functioning, right?
So that's a great point. And one of the other focus points for Powered for Patients is promoting emergency power resilience. Just as Flash is focused on building resilience over its 20-year history, roof straps, impact-resistant glazing, There's a lot that a facility manager can do to minimize the risk of a loss of emergency power. FEMA has great checklists, and we work closely with FEMA. We promote those checklists to facility managers. But John, even with brand new generators, we've seen failures, which speaks to the critical importance of accelerating the time frame from the onset of a problem to notification of government and utilities.
Now, correct me if I'm wrong, but the two basic tenets of what you're trying to do, cut down response times.
Yes.
And avoiding, if at all possible, the need to evacuate at all.
Absolutely.
So that's about right. So the next question is, if you want to talk about blue sky, you're working on a new pilot program, right, with the DHS?
Yes, correct.
Funding from DHS that could dramatically reduce the risk of loss of life and the need to even evacuate, right? Tell us about that.
Potentially. So the early warning protocol that I spoke of, there are two ways to act upon that early warning protocol. Right now in the United States, we have about 6,000 hospitals. 2,000 of them have a very sophisticated, advanced technology in place today. It's remote monitoring and automated reporting. Anytime a mechanical fault occurs in these systems, an automatic notification is sent to the facility manager, to their service provider, alerting them that there is a pending problem with their emergency power. Not a single case in this country is a hospital sharing that information with government officials or utilities. You would think it would be so simple to just say, can you please add these government officials and this utility point of contact to your distribution list? It's not happening. So part of our work is to facilitate a consensus process with hospitals, government, and utilities to ensure that that type of communication occurs. And thanks to that technology, the potential to have real-time notification to government officials is there. We simply have not yet put the pieces together and the people together to make that happen.
No, there was a real-time example that you shared with me about Hurricane Hermine.
Yes.
Which is a real good example for this audience of how things can transpire.
Absolutely. So Hurricane Hermine came up the west coast of Florida in, I think, September of 16, I believe. And it spawned thunderstorms. There was a hospital in Hudson, Florida that happened to be equipped with this advanced remote monitoring technology. And it was struck by lightning. An electrical box on the roof that carried both electrical service for utility power and emergency power was hit. And so suddenly the hospital had lost utility power, and its emergency power was not properly powering up. And within 20 minutes, they were in the midst of an evacuation. Luckily, no patients died as a result of it, but when they called their electrical contractor, they literally didn't know what was happening. They couldn't, even standing in front of their machine, see what the problem was. But the electrical contractor knew that that system was wired with this advanced technology. He got the vendor on the phone as he was racing to the hospital and asked, get online and show me what you're looking at. He did that, and he was perplexed and said, what do you mean you don't have utility power? I'm looking at your monitoring feed, and I see it's right where it should be. That is a live utility line right there. You do have power. No, they're telling me they don't have power. So as the remote monitoring person dug further into his dashboard, he discovered that the automatic transfer switch, which is the device that regulates between utility power and emergency power, had been fried in the lightning strike. That is a catastrophic failure within an emergency power system, and the person immediately knew this facility is going to be offline for at least 1 or 2 days. That information was not made available to government officials that were suddenly trying to help in evacuation. It was relayed to the facility staff, who then realized, okay, now we understand why we don't have emergency power. That is a great example of the kind of real-time information sharing that could be more systematically provided to decision makers.
Now, if you had this information sharing system and you looked at it, okay, you have all the hospitals here, nursing homes, and they could report to what, color-coded, somebody would actually be monitoring your systems remotely, and they would know, we might be seeing something go terribly wrong over here, but all these places are doing okay, right? Is that how that would work?
Well, so this is new territory. So as I said, this sharing of real-time data has not occurred anywhere in this country yet. What's happening with vendors presently is that they are doing that for their clients. So there are technology leaders out there that have hundreds of clients across the country. They have command centers. They are monitoring that information. Department of Homeland Security has provided funding to Powered for Patients to develop a prototype that will take the data streams from the 6 or 7 vendor systems out there and synthesize it into a single data stream that will populate a dashboard that would allow a government official and a utility to see red, yellow, green indicators. You know, red indicators would be a catastrophic failure, like the automatic transfer switch at the Hudson, Florida hospital.
Right.
Green indicators, no need to worry. Yellow, you better start paying attention. That's what we're looking to develop, and with the DHS funding, we expect to have a prototype in place by the end of next year.
What's the trigger for when there has to be something that triggers, okay, the information start, because you're not sharing that information 24/7.
No, the protocol that we're proposing is only in a disaster. So we've had some conversations with hospitals, and you can understand that they are a little leery about giving government access to their emergency power system on a continuous basis. So we would need to define some triggering event. Perhaps the National Hurricane Center's declaration of a hurricane watch or warning might be that triggering event, and facilities and their vendors would then flip a switch, and that data transmission would begin at that point.
Now, that begs the question, okay, an earthquake. We don't know necessarily in advance that the earthquake is going to happen.
That's
so
right.
You have another set of issues there to deal with when you have those kind of events, right?
Absolutely. So a no-notice event would, it's a great example of the reason why you would need advanced planning, so that there is some triggering event and some ability of a person not within the impacted area to initiate the process of that data sharing.
We've got about 2 minutes left. Wrap up where we are, where you think we should be going. Are we at all getting better at this yet?
I would say that Flash has come incredibly far in 20 years with its work. In terms of emergency power resilience and this accelerated communication, we're really at the starting point. It is incredibly basic right now in terms of how it happens. In Florida, I'll give you a quick example. Hospital calls its county emergency management agency and says, our generator is kaput, we need help. Most counties don't have generators in Florida. They're going to call up to Brian Kuhn's office, or would have called Brian Kuhn's office, and said, we need help. A colleague of mine from the Florida Hospital Association sits in the EOC during disasters, John Wilgus, he's their disaster planning person. The state official turns to John Wilgus and says, we've got a request from Tampa General Hospital for a generator. Call your member and make sure that they really need this help, because this is a scarce resource. We don't want to deploy it unless they really need it. That is a terribly circuitous process that could add hours to the process of getting help to a facility. The technology's out there today to make that real time.
Still a long way to go, though, as you're saying. A lot of work to do.
A lot of work to do.
The hospitals, the nursing homes have kind of ended up on the short end of this whole thing, right?
Well, actually, I wouldn't say so. So the tragedy in Hollywood Hills, the Disaster Recovery Reform Act that was just signed into law last month, has a provision in it for prioritization that is a direct result of the tragedy at Hollywood Hills. Provision calls for the prioritization of resources, utility power restoration to hospitals, nursing homes, and long-term care facilities. Legislation also calls on collaboration between government, utilities, and those facilities around disaster planning. So that's very encouraging to see a brand new minted federal law addressing these issues. It gives us sort of a runway to move down this path.
Eric, wonderful. Thank you so very much.
Thank you, John.